Hello there, ladies and gents. Welcome back to the MRI Safety series. In the next two videos, we are going to have a look at the contraindications in regards to MRI safety. Magnetic resonance imaging scans are generally considered safe and non-invasive. However, there are some contraindications or situations where MRI may not be recommended or require special precautions. Please note that it's always recommended to consult with a healthcare provider or radiologist who can assess the individual's circumstances and determine the suitability of an MRI scan. Some of the most common contraindications that we will discuss include 1. The presence of certain metallic implants. 2. Ferromagnetic metal within the body. 3. Pregnancy. 4. Claustrophobia. 5. Inability to lie still. Let's discuss the presence of certain metallic implants. MRI machines generate a strong magnetic field which can interact with metal implants. This interaction can cause movement, heating, or image distortions. The specific contraindications vary depending on the type and location of the implant. Examples of implants include pacemakers or implantable cardioverter defibrillators, cochlear implants, aneurysm clips, and neurostimulation devices. In addition to ferromagnetic attraction, such devices may also experience torque. This term describes a rotational force that causes the alignment of an object to the lines of the magnetic flux. Any ferromagnetic implant is likely to experience this turning force until it becomes aligned with the static field. For devices such as aneurysm clips, this could be for the entire duration of the MRI procedure. There are various factors that affect the level of risk associated with torque effects. Some implanted devices such as orthopedic intramedullary nails or hip replacements are anchored to the bone with screws or cement. These would be unlikely to experience torque-related movement even if they were ferromagnetic. Some devices also become immobilized due to fibrosis or scar tissue over the weeks following implantation. On the other hand, some body areas such as the brain are composed of very soft tissue where fibrosis does not occur and where there is no body anchor. The shape of the implant is also an important factor as shown in the image. A long, narrow device such as a surgical clip lying at an angle to the lines of flux experiences a rotational force. It essentially behaves like a lever. The fulcrum, which is the center of rotation, is likely to be where the clip is anchored to the blood vessel. As the clip aligns to the external field, there is a risk of damage to the neighboring anatomy due to the twisting rotational forces. To date, there has been at least one fatality attributed to torque on an implanted aneurysm clip. In this case, the patient was aware of the clip but was allegedly misinformed about its MRI safety by the hospital that performed the clipping procedure. This incident highlights an important lesson for practitioners. Unless the pedigree of an implanted clip or device can be ascertained with certainty, the procedure should be cancelled or postponed until further investigations have shown beyond a reasonable doubt that the examination is safe to go ahead. Documentary evidence such as the patient notes must be taken into consideration, and an examination should never be initiated on verbal evidence alone. Other implanted devices such as cardiac pacemakers and implantable cardiac defibrillators may contain ferromagnetic components and batteries. These may result in an interaction with an external magnetic field. The translational attraction and rotational force may cause the device to move when introduced into a high spatial magnetic field gradient. Some modern implanted cardiac devices are less ferromagnetic. They have advanced circuitry and may be conditionally safe to scan. Under these circumstances, the devices must be remotely programmed into an MRI safe mode. The examination should only be conducted under the jurisdiction of a cardiology team and under strictly controlled conditions. The next contraindication is early pregnancy. First trimester is generally considered a contraindication for undergoing magnetic resonance imaging due to several reasons. The first reason is due to the fact that there is limited safety data. Conducting studies specifically designed to evaluate the safety of MRI in early pregnancy is challenging due to the ethical considerations. As a result, there is a lack of comprehensive research to establish the exact risks associated with MRI during this period. The second reason is due to the potential for contrast agent exposure. In certain cases, a contrast agent may be used during an MRI to enhance the visibility of certain structures or conditions. While the safety of some contrast agents in pregnancy has been established, others have not been extensively studied, and their effects on the fetus are not well understood. The third and final reason is the risk of thermal effects. The radiofrequency waves used in MRI can lead to heating of the body's tissues. Although the potential for significant temperature increase is generally minimal in routine clinical imaging, the developing fetus is more susceptible and thermally vulnerable to temperature changes. There is a theoretical concern that even slight temperature elevations could potentially have adverse effects on fetal development. Given these concerns, it is typically recommended to avoid performing MRI during early pregnancy, unless there is a compelling medical reason that outweighs the potential risks. However, every situation is unique, and if an MRI is deemed necessary for the health of the mother, or if there is an urgent medical need, the benefits and the risks should be carefully evaluated by a healthcare professional, considering the specific circumstances and available alternatives. And that brings us to the end of part 1. Thank you so much for watching, and see you in the next one.